these homes is going to be rebuilt. While developing the plans, the designer will accommodate any functional requirements while creating an exterior style that is in harmony with the environment. Spatial reference points will be determined from the finished blueprints. After which, a metal framework will be constructed on which the outer walls can be built. As you can see, the structure's appearance is determined solely by where the designer locates these points. And in many ways, it's very similar to the technique we use to model the functional contours of teeth. For instance, in the case of a patient requiring full mouth reconstruction, we can use this technique to produce a crown out of wax, which would then serve as a three-dimensional blueprint. We'll begin by outlining the position of every cusp and marking the occlusal reference points with wax rods. Once we've inserted wax rods into the maxilla and mandible, we can confirm that the antagonistic rods are optimally fitted by checking for lateral movement. Ideally, the maxillary and mandibular wax rods should fit within the intervals between their antagonists, exhibiting no cuspal interference. Toward the working side means the antagonistic rods fit perfectly. As a result, the maxillary and mandibular molar buccal cusps, shown here by the wax rods, should be free of cuspal interference. This type of lateral movement indicates whether the cusps of each maxillary molar match the intervals between the cusps of its corresponding mandibular molar. We'll also check for lateral movement toward the balancing side. Next, we'll establish the distal and mesial line angles relative to the alignment of the antagonistic and adjacent teeth. We'll apply a small quantity of wax to the central fossa area of the mandibular molar and its surroundings, and then occlude the jaws, thereby determining the lingual cusp markings of the maxillary molar. This also gives us a reference point for the position of the upper lingual cusp's tip in relation to the mandibular molar. Our crown design will be guided by the three-plane concept, which involves considering the distance and play between cusps, checking the occlusal relationship between each antagonist, and determining the points of the lingual cusps. Moreover, we'll be taking great pains to sculpt anatomically correct details when forming the mesial and distal cusp ridges. We'll form the lingual ridges based on the morphological linkage between the cusps and the roots. We'll also take into account the relationship between the cusps and fossae during mandibular movement. By forming the skeleton in precisely this way, each molar's contours are both functionally and anatomically accurate, eliminating the need to perform any shaving. Next, we'll build up the buccal cervical ridge following the contour guideline and the three-plane concept for modeling crowns. Although the build-up from the roots to the cusps need to be considered, the ridge height represents the most prominent portion of the crown on the buccal side. And once we've established the buccal center point, we've determined all necessary points of reference. By filling in the spaces between these points, we can easily design and shape the tooth contours to satisfy the three-plane concept. To enable us to check and adjust the occlusal relationship, we'll cut the wax rod slightly longer than needed to match the crown's actual height. We'll also remove the molar's maxillary buccal cusps to avoid hindering formation of the occlusal plane. Contact ribbon is used at this point to determine the occlusal relationship. With a round burr, we'll drill holes at the upper lingual cusp tip positions marked to receive the wax rods, taking care not to drill all the way down to the surface of the tooth. The technique we're demonstrating here is perhaps the most pragmatic approach for the task at hand. The next step involves establishing the line and plane of the occlusion. We'll connect a Broderick occlusal plane analyzer and, using a compass centered on the top, draw a 4-inch radius arc to the distal ridge of the canine tooth. This is called the ASP, Anterior Survey Point. We'll add an intersecting arc based on the distobuccal cusp tip of the mandibular second molar. This is the MPSP, Molar Posterior Survey Point. The point of intersection, or the OPSC, Occlusal Plane Survey Center, then serves as the center for a 4-inch radius arc, which determines the occlusal plane. The procedure is the same for the other side. We'll prepare a customized cusp fossa instrument to sculpt the mandibular molar cusp's inner angle of inclination, keeping in mind the occlusal plane as determined by the previous anterior guidance. We'll use a cusp fossa pin to scrape out the anterior guidance angle into the anterior guidance table while laterally moving an articulator. We produce the cusp fossa instrument by pouring resin into the wax impression. We'll place the tip of the instrument on the central occlusal point and sculpt the disengagement angle by scooping out wax while using the spoon-shaped portion. Note that we can create a steeper groove below the deepest point of occlusion, since this region does not make contact with the antagonistic tooth. Our intention is simply to raise the mastication ratio while improving the spillway function. We'll record information about the contours of the mandibular occlusal plane and the positions of the molar cusp. This then will enable us to begin ceramo metal construction. Using the anatomical shading technique, we'll build out of porcelain an anatomically harmonized replica of the tooth, giving it a more realistic, three-dimensional color tone and refraction pattern throughout. We first apply the opaque porcelain. We then use it to form the maxillary central incisors, coating all surfaces with a thin, uniform layer, ideally one which is about 0.2 millimeters thick. To replicate as closely as possible the opacity of natural tooth dentin with a dentin porcelain, we'll mix a small amount of opaque porcelain with the enamel porcelain used for the dentin structure. This should give us the colored tone and harmonized anatomical structure necessary for matching the adjacent teeth. Now we'll design the dentin formation. This involves directing the tip of the dentin toward the center of the incisal table. To ensure a natural appearance, highly translucent vertical lines are required